Hey y'all, before we get rolling, if you run a nonprofit, this is for you. Comfy Stone just released a free 90-day donor retention checklist to help you keep more donors through authentic storytelling. Get your copy at comfystone.com/checklist or click the link in our show notes. Now let's dive into this week's episode. Hi, everyone, and thanks for joining us for our special Maternal Health Month series. I'm joined by Dr. LaRose.
Hello.
She is a childhood adolescent psychiatrist. Our guest today is Kimberly Novod. She is the co-founder and executive director of Saul's Light, a nonprofit dedicated to support NICU and bereaved families across Louisiana. Welcome to Missions Bayou, Kimberly.
Thank you for having me.
So I want to start with, what is the mission of Saul's Light and what kind of programming do you guys offer?
Yes. The mission of Saul's Light is to support NICU families and bereaved families in the ways that are most meaningful to them. And so what this looks like for us is through direct services, through education and advocacy, and just all around holistic, comprehensive support for the wellness of families.
Can you explain just like really quick what you mean by bereaved families, just so that people understand?
Yes. The families that we work with have experienced loss from about 20 weeks of pregnancy, which is determined to be a stillbirth, and up to a year after the birth of a child. Usually the families that we work with are experiencing loss after a NICU stay, whether it's a short NICU stay or a lengthy NICU stay. That's the largest group. And then the next largest group would be those who experience stillbirth.
Okay. What kinds of feedback do you all get from families that y'all work with?
I think what families say the most is how lonely the experience is.
Yeah.
It's very isolating. I identify with that as I am a NICU mom. My son was in the NICU, and ultimately he passed away. Wow. And during that time, whether it's my experience or other families, people really feel that they're alone in their journeys. They feel, maybe they don't know someone that this has happened to because it's not a thing that we talk about. We really sort of keep it to ourselves. And so people just feel really unlucky. They sometimes feel it's their fault. And so, I think what we do is to give families a lifeline to say, look, there's a community of people behind you. We've been through it. We've experienced it. And we're here to show you or to be, an embodiment of what it looks like to survive.
Yeah, that's amazing.
What kind of programming do you think you provide for these families in those times, whether it's currently with a NICU baby or the bereavement period?
For the NICU families, it's a little different in that it's time sensitive. We work with families while their babies are in NICU. A lot of the babies that are there are born prematurely, not all, but most of them are. And so they could spend anywhere from, 2 weeks to 2 months to 6 months in the NICU. And so we're there with them every step of that journey and probably up to 2 or 3 months after their discharge. And so our work with NICU families while their babies are in NICU looks like encouraging them to be parents and empowering them in their role. It's very disorienting to have a baby in NICU. You have to ask for permission to hold your baby, sometimes touch your baby, to change your baby, right? These things that sort of really either come natural to parents or you've learned them in a parenting class and you want to care for a baby. It's
well, the things you expect, right?
Yes.
I've had this baby, now it's time to change the diapers and feed and do the
That's
checklist
exactly
of things,
right. Right. And so you're going through the thing I mentioned earlier where you may already have internalized, oh, this is my fault, this is my failure of some kind, my body or something, right? And now I can't even do this, now I can't even change a diaper or, make milk, right? Whatever the thing is. And so when we are working with families, it's to say, look, you provide something for your baby that only you can give, right? And so we call this prescription parent, right? And that means like holding your baby skin to skin, pumping breast milk if you want to, reading to your baby, talking and singing, and participating in caregiving tasks, so maybe it's taking a temperature, maybe it's changing a diaper, maybe it's decorating your NICU space, right? Something that really sort of gives you agency.
Yeah.
And you don't feel like this awful thing is happening to me and it's out of my control, which is really how parents feel, right?
Yeah.
So also to that end, with our partner hospitals, we have little NICU libraries. And so the initiative is one that encourages reading, but as a way to bond and form attachment, which is so critical during that 0 to 3 phase.
Yeah. So how do you all find these families, or how do the families find you?
We work very closely with hospitals. We've been, I think, incredibly blessed to have the level of engagement that we do with our local hospitals. We have official partnerships with all of the hospitals that are in New Orleans. And then we work with other hospitals that are outside of the parish by referral basis. We have representatives in Opelousas, Lafayette area, and also Baton Rouge. And so either families are referred to us by a social worker or they're referring themselves to us because someone they know either knows us or has, worked with us before. Maybe a caseworker, for example, is telling them about us. And some families, when they're up late at night and they're either pumping or thinking about their babies, maybe they're on their phone and they come across our profile on social media. We actually get a lot of people that say, I saw you on Instagram.
Oh.
Yes.
Okay.
So I know that's not where your work ends. You also are involved in advocacy. Can you tell us some of Saul's like involvement with advocacy?
Yes. Our thinking is, direct services really touch people when they're in the moment of crisis, right? And we want to do that and we need to do that. But we also know that if we want to have a better future, a brighter future for Louisiana and its babies, we have to think more upstream and we have to think long term, right?
Yeah.
And so for us, what that looks like a lot of time is policy change. And whether it's us working directly with legislators or in coalition with other groups, we're thinking, how do we, first of all, prevent babies from going to NICU in the first place?
Yeah.
How do we empower families to safeguard their mental health? How do we encourage fathers to be active participants in their baby's life? How do we demonstrate the importance and life-saving, composition of breast milk? It's quite literally medicine for sick babies. And so in order to do that, we have to think what can be done better. And so to those ends, we have so far participated in making sure that families have access to the stillbirth tax credit. And so for families that experience stillbirth, they are able to avail themselves of a $2,000 tax credit. It is claimed in the year that the baby is born still. And what this allows families to do is to be able to get mental health. It's most therapists are not covered by insurance. They also a lot of times have to recoup the cost that goes into building a family. If they want to have more children, sometimes they have to do genetic testing. If they want to find out what happened, they have to do autopsy, right? And I mean, I think the average person would be surprised to know that all of those things are not free and they are not cheap. Right. And so that was a very important, piece of legislation that we were able to work with Representative Stephanie Hilferty on. And then also we went back and worked with her again on 2 bills that created greater access to donor human milk. And this is super important because when babies are sick, sometimes their little bodies can't handle cow-based formula. they need human milk, and that's just what's healthy for them.
Right.
But if for some reason their mother is not able to provide the breast milk, they can have access to donor milk that's at the milk bank. And those laws made it so that babies would have access to it no matter their insurance, if they're on Medicaid or commercial insurance, while they're in hospital and up to 2 months after.
That's wonderful.
And so it's, it's good for their health. It sort of limits any sort of illnesses that they may contract, like necrotizing enterocolitis, for example, is a big thing that comes up with cow-based formulas. And so, again, it's about us saying, what does our future look like?
Yeah.
How do we help people now at this moment? And then also, how do we prevent people from coming to this area of trauma? And how do we make sure that like all babies are born healthy, that they live, and that families have all the things that they need to be able to be the parents that they want to be to take care of their babies?
Yeah, that's amazing.
Thank you.
What would you say are the main gaps in knowledge that you see with families, and what kind of educational initiatives does your organization offer to address those gaps?
I think one of the biggest gaps that we see is something that we, talked about, which is people may not realize that they have a very important role, a vital role to play in their baby's hospitalization. And so, we want them to know you are part of the care team.
Yeah.
You have the same value as a doctor or a nurse. You have the lived experience. This is your baby. You birthed this baby. You have the instincts for this baby, right? Science can't explain instincts, but any person who, has a mom can tell you how motherly instincts work, right? And a lot of times they save lives. So we want to encourage families to tap into that and say, no, you're not iced out of this situation. You're not isolated from what's happening. When you can be present at your baby's bedside, when you can be involved in their care, they have better outcomes.
Yeah.
They gain weight faster, they're healthier, they're more regulated, and they go home sooner. So we want to say to families, you got to be there. And if there's a barrier that is preventing you from being there, then let us help get you there.
Right. Do y'all have any statistics on that?
There are so many statistics that show the importance of parental involvement in the NICU and for preterm babies. And it's because of all the things that they can do, right? Like skin to skin. People think, oh, you're just holding a baby.
No.
But it's not that simple. That's what it looks like, right? But there's a lot of other things that's happening below the surface and that can be measured by science, right? And so it's the regulation of breathing, the regulation of heartbeat, the ability for the brain to grow because the baby feels safe. Right? And now the baby can eat because the baby feels safe.
Right.
Yes. And you're smelling mom and you're touching mom and it feels like home.
Well, and I've heard that babies can hear in the womb. So I'm also assuming like now being out of the womb, that baby is like, I'm looking for those familiar sounds.
Yes.
And so hearing my parents in the room, talking to me, reading to me also feels like home.
Yes.
Comforting.
And it's as disorienting for babies as it is for parents.
I'm sure.
Right? The bright lights, you all know. You know that the lighting in hospitals, right?
And the beeps.
Yes, it's a lot. It's the beeps and things,
Turn the
right?
beeping off, please.
Right. And this is a thing that really impacts families. So we know like 40% or more of parents experience PTSD, and they talk about the beeps and the machines and the smells and the sounds. But no one, to my knowledge, has looked into that sensory overload impact on babies. Right? And they can't talk, so they can't say, oh, I remember this. But one thing we all know from just research and literature is that the body keeps score. Right?
Yes, it does.
So the babies, their bodies know.
Yeah.
And that's why it's so important for them to be in the loving arms of a caregiver, that they feel safe and that they can thrive.
Real quick, guys, did you know it can cost up to 7 times more to find a new donor than to keep one you already have? That's why at Comfy Stone, we created a free 90-day donor retention checklist. It's simple, step-by-step guide that shows you exactly what to do after someone donates. From how to thank them to how to tell stories that keep them engaged and giving all year long. You can grab your free copy at comfystone.com/checklist or click the link in our show notes. All right, let's get back to the show.
I love that.
So speaking of that, like healthcare environment, how is Saul's Life focusing on educating medical professionals about the NICU environment?
Mhm. We work with healthcare professionals at all of the hospitals. Again, I think that we have really set the standard when I, engage or talk with my peers across the country. Some are parents like me that are
Mhm.
running support organizations, and some are healthcare professionals that are leading in research. And to almost all that I speak with, it's almost unheard of the level of engagement that we have with hospital systems like
Wow.
Ochsner Health and LCMC. And I put that down to, a commitment to health equity, which is so important, a commitment to addressing disparities, those, the things that we experience here, disparities, particularly in birth outcomes,
Mhm.
prematurity, infant mortality, things like that. And so, with this sort of unprecedented relationship that we have, it really comes down to building trust and and treating that trust as sacred, right?
Mhm.
So I think that our hospital partners see us really as partners,
Mhm.
and we see them the same. We all want the same thing,
Yep.
which is healthy babies.
Yep.
We want good outcomes for our babies, and so to that end, we work to figure out how do we create an environment in the NICU that feels as close to home as possible?
Yeah.
So we talk a lot about family-centered care. We do things like workshops or webinars, and annually, our big event is a NICU Health and Equity Summit.
Mhm.
And so this is an event where we gather all of the stakeholders, not just healthcare professionals, but families themselves who have gone through the journey and community leaders as well.
Mhm.
And we tried to create solutions to like whatever pressing issues are facing the NICU community. So families are the priority, and then healthcare professionals are next,
Mhm.
because we also know the strain that it is to be a caregiver,
Yeah.
right? Which is also hard. So just as we're pouring into families, we pour into healthcare professionals as well.
Mhm.
But what the NICU Summit allows us to do is to really collaborate and sort of take off the hat of hierarchy.
Mhm.
Like doctors know best. Doctors know medicine. They've
Yeah.
gone to,
Mhm.
med school, and that's important. And families know their babies best,
Yep.
and that's important,
Mhm.
right? And none of these things are better than the other. They're
Right.
different.
Right.
Work
That's it.
together.
They
We
gotta
work
work together.
together.
Yeah.
Yes, we have to work together if we want our babies to be healthy, right?
Mhm.
And so, out of that summit, we've developed so many different things, from advocacy initiatives to a new lactation support program, which I have the milk truck right outside. So this is a car that goes to pick up breast milk at a mom's home and drops it off for her baby in NICU.
Oh,
Or
wow.
if she's experienced loss and she wants to donate her breast milk in memory of her baby, we'll
Mhm.
go and pick that milk up and bring it to the milk
Oh,
bank.
love that.
And so this is something that came directly out of the NICU Summit,
Mhm.
and I think shows what's possible when
Mhm.
everybody comes to the table with the same goal in mind.
Yep.
And doesn't want to just talk.
Mhm.
Yeah.
Let me get the
Talk.
mic.
Let me get the
Right.
mic. Let me talk over
Yes.
you. Instead, we're actually building actionable
Yes.
things that
Yeah.
make
Yes.
the change and give the support to these families.
Mhm.
Yes, absolutely. And we know that they do,
Mhm.
right? I think for sure that healthcare professionals try their best. I think that they're doing their best for babies. And I think they're under an incredible amount of stress.
Right.
It's not easy. Same thing for social workers or therapists or, anybody that's working in the healthcare field, right? There's never enough time.
Mhm.
There's always too many patients because we live in the deep South, and that's the state of healthcare,
Yep.
right? And so I think that if we can all meet each other from that viewpoint of we all want the same things,
Yeah.
right? Then we can work together to develop, right, the programs or initiatives or collaborations that's going to lead to the good things, the healthy things, the things we all agree on.
And I'm sure it helps to point out the gaps that people are not thinking about,
Yes.
right? Like most people are not thinking, oh, the mother who lost her baby still is producing breast milk. And
Yes.
like, what do we do with that?
That's exactly right. That's right. And, you know, just like you said, people don't think about it. Sometimes it's not malicious.
Right.
Sometimes it hasn't occurred, you know? And then what we enjoy with those relationships built on trust is that, you know, we're able to work with a hospital to make sure that NICU parents have access to healthy food, right? And before that, it wasn't being offered.
Yep.
And not because it was malicious, because it just never occurred to people.
Yep.
Right? There was food for some people, lactating people, and that's great because lactating people need to eat, but also all people need to eat.
Yes.
And when you're in the NICU and you're seeing your baby, you kind of don't think about the fact that you need to eat.
No, I'm here for the baby.
You're here for your baby, right?
Mm-hmm.
And also, you know, the thing about skin to skin is once you get into that kangaroo care mode, you could be there for hours.
Yeah. Yep.
And there's nobody there feeding you
That's
cheese
right.
straws
You
or
can't
something.
move.
You
can't move. You can't go
moving.
to the bathroom. You can't eat. You can't drink. You can't do anything, right? And don't let it be a really small baby with all kinds of tubes or wires.
Right.
It's going to be a long day.
Yeah.
It's going to be some holding going on.
Yeah. Can you tell us a little bit about the support groups that you mentioned earlier?
Yes. So we work with fabulous licensed clinical social workers. We have programs in English and in Spanish. And so these are also happening in the hospital communities for families that can barely tear themselves away from their baby's bedside, and also happening in the community for families that may need a, you know, scenery change and maybe can feel more comfortable for their mental health not to be in a hospital environment. And so we've been doing this now for years. We also have support groups for families who experience loss as well. And these groups are completely free of charge to the people that, you know, want or need to attend. And I think, you know, what they do is sort of bring mental health to the forefront so it's not stigmatized.
Yep.
I think when people are having a really hard time with NICU or loss, they think it's like a personal failing. And it's not. It is a completely normal reaction to an abnormal situation.
Yeah.
And people need to know that, right? This is not a weakness in you, right? This is a really hard thing.
Yeah.
And you haven't experienced anything like it. So it's going to require you to do something that maybe you never done before.
Yeah.
And that might be a support group, you know, or it might be a peer mentor, which we offer for people that want something casual, you know, less time commitment, if you will. And that's just a person who has experienced the similar circumstances and sort of reach back to encourage the person, to motivate the person, not offer medical advice because we don't do that, you know, but to be, again, a living example of like, you're going to survive this and I'm the proof of that.
Yeah. And I think that helps so much hearing from someone who has actually experienced it, right?
It changed my life.
Yeah.
I think, you know, that's how I got here, really. When my son passed away, I was one of those people that thought, you know, oh, this is so hard. Why is it so hard for me? I should be stronger, mentally stronger, or, you know, get over it. That's not how it works. And I wind up going to this yoga retreat in Canada from this lady that my sister found on the internet, like Instagram. And I went there, and to be surrounded by women who had experienced loss in all different types, right? I was able to, one, free myself from the guilt of having preterm labor and a preterm baby, and then really just understand that, wow, this is a great offering for women who have experienced loss. What can I offer?
Yeah.
And that's how Saul's Light came to be. This is my offering to the community
Yeah.
to say, let's have each other's back. Let's
Yeah.
get together.
Yeah.
Yeah. That's amazing. Okay, so in the next 5 years, what change would you like to see happen for maternal health in Louisiana?
In the next 5 years, my goal in life will always be to reduce the prematurity birth rate.
Yeah.
I have a personal vendetta against prematurity.
Mhm.
If there was like not another preterm baby born ever anywhere, I would like to do that.
Yeah.
But I think, in the meantime, I think that my work is to work, right? It's to realize that prematurity, this issue, related issues, they didn't start with me. They aren't going to end with me. But my work is not to give up.
Yeah.
And my work is not to be so sort of crushed, by the heaviness of the fact that the prematurity birth rate increased since last year, and it probably will increase as long as, women don't have access to adequate care.
Yep.
But my work is to keep going, right? I live by this mantra that I'm not required to finish the work, but I am also not allowed to desist from it.
Yeah.
Right. So I have to keep going. And so in the next 5 years, I would love to see Saul's Light grow to continue to expand across Louisiana. We know that in the rural parishes, families are having a hard time accessing support and care, maternity care, all of the things, postpartum care. So we want to continue to work in coalition with others to make sure that there aren't maternity care deserts, right? Because that's not good for infant health, right? And infant health is tied to maternal health.
Yes.
So we cannot take these two things apart. If we want to see one get better, the other one has to get better. I think that we're going to take on more legislative advocacy. And, ultimately, too, what I would like to see is somewhere we solve for transportation. I find that in our work, the biggest barrier to parents being present at their baby's bedside is lack of access to transportation.
Yep.
And I'll raise you one. I've talked to a lot of other nonprofit organizations, and transportation is always the culprit.
Oh, I think across
of
the
why
board.
things don't work. Right?
If you're serving adults, children, I didn't realize it either that like if you're trying to service a group, a demographic that doesn't have access to their own transportation, you can't get them to the job training. You can't get them to the music lesson you've set up for them. It's such a barrier, and it's also such a huge expense. There isn't a cheap way to transport people.
No, there's not. No. There isn't. And what we found is that, for example, if you're a NICU parent without reliable transportation in New Orleans East and your baby is uptown, both of the level 4 NICUs are uptown, it's $50 each way.
Wow.
Each way in an Uber or Lyft or, so that's $100 a day.
To see your baby.
To see your baby and to give life-saving medicine to your baby. Right? It's restrictive.
Yeah.
I work every day and I couldn't pay $100 a day for transportation. Right? And you want to be there every day. So it's not like you're like, well, I can go this day and not next week or, I'll
this
go in 3 weeks.
This isn't a hobby thing where it's like, I'll just go twice this week. Right. You want to be there 7 days a week.
Want to be there, right? So transportation is such a barrier.
Yeah.
And I would like to see it not be.
Yeah.
For any sort of social services.
Yeah.
Right? How do we make New Orleans healthier, make Louisiana healthier?
Yep.
We have to start there.
Yeah.
And it has to be through access.
Yep.
Well, how can people support and connect with Saul's Light?
I love this question. People can connect with Saul's Light. We're on all social media platforms. Our website is saulslight.org. And the best way for people to support Saul's Light is, one, by donating during Give NOLA. Give NOLA is coming up Tuesday, May 5th. This is super important because we are an organization that provide unconditional cash assistance to families so that they can be supported in the way that is most meaningful to them. And so Give NOLA is a campaign that really allows our community members to give directly to the NICU parents and bereaved families in their community. It's really about mutual aid, and it really is about saying, you know, I have a problem with a family not having access to transportation.
Yeah.
Let's give them gas gift cards, or let's provide the Uber, or let's do the Greyhound from, you know, Monroe to New Orleans, right?
Yep.
Or saying that, yes, I think mental health care should be accessible. So let's make sure we have, you know, meetings every month, or that a family has access to one-on-one support with a therapist if they need. That is the best way to support Saul's Light, is through donations, because all of our programming is free to families, but is not free to run.
Yeah. Yep.
But there are many other ways to support Saul's Light, and that is through partnerships, that is through collaboration. So like we've worked with local businesses, everything from, you know, coffee to candles to nail polishes. We've done some really great partnerships with local businesses that have a connection to our mission or just believe in health equity.
Yeah.
And so, you know, working with us, volunteering with us, partnering with us, making an introduction for us, those are all equally as important ways to support Saul's Light.
That's amazing.
Well, thank you so much for joining us, Kimberly.
Thank you. Thank you for having me.
Thank you.
Thanks for listening to Missions Bayou, powered by Comfy Stone. If you enjoyed this episode, be sure to follow the podcast wherever you listen. And if you're watching on YouTube, don't forget to subscribe and drop a comment, letting us know your thoughts and who you'd like to hear from next. We'll see y'all next time.